The thyroid gland plays a critical role in how our body manages a multitude of functions, many of which we take for granted. Think of it this way: if your metabolism is an engine, the thyroid is the gas that keeps it going. The thyroid affects our heart rate, the way our bodies regulate heat, our skeletal growth, and much more. Recent advances in thyroid imaging have considerably improved the ability to diagnose and treat thyroid disease. We spoke with Jason Mulder, Supervisor of Nuclear Imaging at AdventHealth Waterman, to get a better understanding of how their advanced imaging technology can help patients get to the bottom of their endocrine issues.
Imaging is used here at the hospital to detect endocrine issues using ultrasound and using nuclear medicine. Those are the two main tests that we normally use. You might feel a lump in your throat around your thyroid gland. If you have difficulty swallowing, things of that nature, the doctor would normally order an ultrasound of the thyroid just to see what they can see. That's not uncommon. The ultrasound of the thyroid is generally designed to look at any physical abnormalities. If there's any cysts or if there's any thyroid nodules, they want to see the size, the number, location, things of that nature. Once they find thyroid cysts, they'll generally do a needle biopsy. If they do a needle biopsy, they'll do it right here in the ultrasound department. Doctor will aspirate the area they're looking at, and then they'll send that off to pathology to test to see if they're benign or not benign, or if they're cancerous. And then it's very common after that to do a nuclear medicine test, which is a thyroid uptake and scan. With a nuclear medicine thyroid uptake scan, there's definitely a patient prep list that you have to follow, and that's something that we explain to each patient as they come in. But generally speaking, you would come in the first day of your test, you would take a capsule. The capsule that we give you is basically radioactive iodine, so it's like radioactive table salt, for lack of a better explanation, okay? Your thyroid takes up the iodine, and then we image it 6 hours later. At 6 hours, we also do an uptake, which gives us a percentage of the capsule that got taken up by the thyroid gland. And we also do an uptake at 24 hours as well to see if they're considered normal. The technology of the equipment that we have in ultrasound and in nuclear medicine is state-of-the-art equipment. So we're going to get the best possible images that we can get. If we do find out that it's a cancerous lesion or something we need to be worried about, we have a cancer center that's right here with all the experts that they need to take care of them.
To find out more about AdventHealth Waterman Imaging or their board-certified radiologist, please click the Advanced Thyroid Imaging Story Link icon on our homepage at yourhometownhealth.com. For those of you paying particular attention, you've noticed that the much-publicized name change from Florida Hospital to AdventHealth took place earlier in January. Following a staff and public announcement back in the fall, Adventist health hospitals across the state and country have been going through a rebrand as they work towards one cohesive name and a universal focus on the whole health of its patients.
You know, the realization that we are part of something really, really big. It's not every day that you go to a name change, but more importantly, not just for the sake of the name change, but our brand and our culture coming as one to deliver care as a national player. I think that's something I'm really excited about. We're going to be spending a lot of time creating awareness and educating our community that while our name may be changing, we are still that social safety net that they can count on to be there all the time.